right. Hello there. Thank you so much for making time for this conversation here on K24 this week. My name is Brian Amuai. Now, June is World Cancer Awareness Month. What exactly do we need to learn? What are some of the lessons that people have gone through that can actually pass to us as a nation and, of course, as the globe? To have this conversation with us, of course, we have Nasra, who is a cervical cancer warrior. Thank you so much for making time.
Thank you.
How are you?
I'm very fine.
Yeah. Welcome.
Thank you.
We also have Dr. Joseph Mageto, a resident doctor at HCG Cancer Center.
Yeah.
Good. Almost said good morning. How are you?
Yeah, I'm good. I'm good. Thank you.
Thank you.
Thank you for inviting me.
All right.
Yeah.
I want to start with you, Doc. June is Cancer Awareness Month.
Yeah.
Why is it so important to spread the message about cancer?
I think the message about cancer in our society is very important because when we look at the numbers, we are seeing more and more people getting diagnosed with cancer, and cancer affects all of us in the society. It affects the people with cancer, it affects their relatives, it affects the caregivers, and it also affects us as Kenyans and our health and our economy. So it's an important topic to be discussed openly with everyone and the public. Yes.
Oh, good. I like that you mentioned the caregivers and just, bringing into this particular equation every other person that actually gets to be affected. Because most of the time we look at the warriors or the survivors or the people that are directly affected. However, the people around them, we never pay attention to that.
Yes, that's true.
From your perspective and, the people that you've been able to interact with, talk to me about the caregiver and how this is one don't want to call it a burden, or how this gets to impact them, when they're actually taking care of a patient.
When we're looking at the caregiver, there's so many aspects of their life that is affected by cancer. First of all, you might find that the person who has cancer is, it's obviously a beloved person. So you get to see the person who you love getting this treatment, getting this diagnosis, and how it affects them. You're also affected emotionally and psychologically, first of all. Second is, most cancer patients require full round care. So some of the caregivers have to stop their job, they have to stop what they're doing so as to take care of these cancer patients. Now, they're affected economically because they can't go to work and support the patient at the same time. When you're looking at also just financially, we get that most of the patients who are treated for cancer, the treatment is expensive, and these people need to fundraise money so that to support these people. So a lot of funds directly go to finance the treatment of these cancer patients. So it's wholesome when you're looking at the caregivers that they're also affected a lot by the cancer. Not only the patient, the caregivers are also affected. Their lives are affected. They have to stop what they're doing to take care of these patients.
Okay.
Yeah.
All right. Nasra, hi once again.
Hi.
You are now our warrior here when it comes to matters cancer, and as we try to spread the message and of course the positivity during this particular month. Before I come to your story, I'd like to just get your perspective in terms of the importance of the month of June, and from your own perspective, how important is it for the message about cancer awareness to be at each and every other person's doorstep?
Okay. First, with the cancer, June being the Cancer Survivors Month, it becomes so encouraging and so heartwarming to know that yes, we fought, yes, we survived, and there are people who know that we fought and we survived, and those people are honoring and celebrating us. And as you're being celebrated as a survivor, you're also looking at that person who is still going through the journey, who is still going through the sickness, or rather who is still facing the demon, and you like, if I made it, and that person can also look at you and say, if she made it, I can also strive to make it. and be where she is right now. Yeah, so you become an encouragement to that person who has just newly been diagnosed, or they were already diagnosed and they are going through their treatment. They look at you and say, I want to get there.
Good.
And it gives them motivation to keep fighting. Yeah, so that is why it is so important that we create the awareness. And just aside from creating the awareness, we also show the people that were able to fight through the disease. Because survivorship is not just having dealt with the disease and gotten healed, but the things that come afterwards. Yes, I finished treatment, I was declared cancer-free, but am I back to my life, like my previous life, 100%? Or are there things that are still affecting me that came with the disease, like the treatment, the side effects of the treatment and all that? So it's not easy to go through survivorship. So when someone stands out there and say, I honor you because you survived, it becomes like, let's say, a fuel for you to keep going. Yeah.
Wow, interesting.
Yep.
So it is selling hope to those that are actually going through that particular journey at that particular time.
Yeah.
You are a survivor, you are a warrior. What is your journey and how do you feel today being here this month, being the epitome of what could be the possibility of any other person that, is currently in that particular state?
Okay, for me, first, when I was diagnosed, it was not an easy thing. It can never be an easy thing
How
to take in.
long ago was that?
I was diagnosed in September 2023.
Okay.
Yeah, so it's about 2 years down. Yeah, so it is not easy because, cancer, they say until it knocks on your door, you will never know the intensity. And maybe you will never feel how heavy the burden is. So when it knocked, it found us at a very bad place financially, with my spouse and my kids. And we had to find a way to thrive through it. And so it wasn't an easy journey, but the support system around you is so important. Because I usually say that if I didn't have a support system, trust you me, I wouldn't be here by now. And waking up every day, it's a privilege, and it's enough reason. Even if I didn't have food, I didn't have anywhere to sleep, I didn't have anything good, to the things that people call good. If I didn't have any of that, I would still say thank you, Lord, because I am alive. I woke up, and I'm not waking up in the pain, because the pain alone is something you don't want even your worst enemy to experience. Yeah, so that is it.
Congratulations, by the way.
Thank you.
Congratulations. And, as you speak, of course, just trying to imagine and put myself in those particular shoes, that I can imagine the kind of, trauma and, of course, the pain that someone, I wouldn't claim to know because I haven't been there. However, I can just imagine that. You say it caught you at a very bad place. No one is ever ready for something like that.
Yeah.
How did your life change when you are diagnosed?
Okay, let's start from here. The diagnosis comes in when my husband is jobless, because he had lost his job like 6 months ago, and we were still searching. And myself, I was also just out of maternity leave. I had a long maternity leave because COVID made me lose my job, then another child followed. So I'm trying to maneuver taking care of the kids, and on his side, he doesn't have a financial income, any generating whatever. So we are here looking at each other like, where are we starting from? So the diagnosis comes in, and I'm like, how do I even start? Because there's no money to even start the tests before it is even confirmed that you are at this stage. So this is how we are going to treat you. You have to go through very many tests for it to be staged.
Okay.
But now you see, you need an MRI. An MRI is almost 20,000. You need A CT scan is like 30 something thousand. You need a PET scan is more than 50,000. And all those are monies that are not just seated somewhere waiting. So it was very tough, but thank God, because my elder sister, she really stepped in trying to source these funds, because we panicked as a family. And worst part is we couldn't tell my mom immediately, because I have an epileptic brother who had just had an attack. The same day I'm being given my results, it's that when I just get home, sitting down wanting to call my mom, I open my WhatsApp and I find a photo of my brother. Amegongwa sijui wapi huko, and he's so hurt. So I'm imagining, how do I download this news on my mom, and already she's dealing with this. So my elder sister tells me, we will have to work through this, me and you and the other people, without mom ever knowing about it until my bro is well. So you see, you
had to keep it a secret from her. To protect her from the shock and whatever was happening. You
want her to hug you, to call you, to tell you it is going to be well, because that's what mothers do. But you can't, because she's also going through something else. So it was a tough period for me. I used to like switch off completely. Thank God my spouse also really understood me. So I could wake up. If I feel I can stay, then fine. But if I can't, I would just tell him, you take care of the household. Let me go somewhere and just breathe and try to think of things. And then I would go to church, just spend time in church, do things in church. Maybe if there's work, clean up, whatever to be done, pray, read the Bible, maybe there's a certain, my spiritual friend, a lady, she's called Catherine. I could go to her house, we just sit, fellowship, read the Bible. She kept giving me, every day actually she was sending me verses just to encourage me and to know that God is for me. So that is what kept me until I shifted and said, at first I was like, I want to die. Actually, I made that attempt. I went kwa barabara katikati, just kugongwa na gari, and because I'm like, who is going to carry this burden?
What happened?
A few ladies that were on the side of the road, because it was karibu na some vibandas, they pulled me away from the road, wakanikelelesha, but because my mind is not even there.
You felt they were not getting what you're going through.
And I couldn't tell them, so I just allowed them to rant, and then I walked off and went home.
What was going through your mind when they were ranting at you? Because you are going through a pain that you feel it is too much for you. Yet you are looking for, I don't want to call it an easy way out, but you see, sometimes when life pushes you to the edge, that's the only thing you're thinking about. And yet there is a group of people that are now talking at you when all you need is just a hug and somebody to understand where you're coming from. At that particular time when they are ranting and telling you, what exactly are you doing? Why would you want to do this to yourself? What was going through your mind?
My thought was like, if these people, if I had a way to talk to them and tell them what I'm going through, it would be easy. But again, I can't do that because they don't know me in the first place. And then the second place, there's stigma about cancer out here. So how am I sure that if I talk to this person, yes, she's elderly, she's a mother, she might give me that hug that I am yearning for, but how am I sure that she's going to take it from my perspective? So it was so hard, but I just so like the way you tell yourself, the inner you, calm down, do not rupture, let them talk, and then when they are done, you just leave. So I just held myself, looked at them, silent, they talked. When they let me go, I went and got to the house, now sat down and said, no, this is too much, I need to talk to my mom. And then I find my brother's phone.
How long had it been you keeping it a secret before you actually revealed it to your mom?
We kept it for almost a month.
Okay.
We went through all the tests, the MRIs, the CT scans and everything. We had a reconfirmation of the test, of the biopsy test at, we did the reconfirmation, like second opinion test. And then when now all those results came in, That's when, and my brother was now doing well. He had gotten out of the hospital. He's now at home. He's better. So that's when we told my mom. But we didn't tell her directly. Actually, I come from a family of 9. And my brother is the only one. So you can imagine.
He's the only boy?
Yeah.
Okay.
So my sister, my elder sister, she used to call all my other siblings. So she's like, today I'm going to tell so-and-so. She calls them, she tells them. The way they react, she told me that none of them took it like without tears. They were first breaking into tears, and then now you just listen to someone crying, and then you tell them, now wipe your tears. We have to see how we are going to go about it. Yeah. But all of them, so she called all my 7 siblings like that, one after the other, one after the other. But they couldn't call me because at that time I had gotten to a point where I didn't want pity parties.
Yeah.
Because when I was going through the test period, or rather let me say the diagnosis period, I went to my pastor and told him, this is what is happening. And he told me, I told him we need a lot of money, and unfortunately, I'm not working and we have a financial problem and all that, so I don't know how I'm going to go about it. I would like if you can help me. So he told me, and I also said, I want you to pray for me. So he said, you have to choose. Do you want prayers or do you want money? And I told him, so my head is spinning.
Okay.
Like, what is this person saying? Can they see the situation I'm in? And I really need an immediate solution. And this is what they can ask me. And he's like, I know. I just said that in my mind, but he said, I know what you're thinking. But do you have faith? Do you trust in God? Do you know that God can do it?
Okay.
And I told him, yes, I know that God is able. And he told me, when I look at you, I don't see the level of faith that I am looking for.
Okay.
I want you to go down, to go sit with yourself and ask yourself, do I need money or do I need prayers? I left that office very angry because I was asking myself, I was like, he's not understanding me. He doesn't know the intensity of what I'm going through. And the doctor who delivered my results to me was he wasn't so remorseful. He told me, because I was crying, like when I was given the results, I was just crying. And then the doctor is like, why are you even crying? We know of older women who have gotten through this, na wamepona, na wako wanaishi. When ni msichana mdogo, unashinda kulialia nini? Enda pigana, you will. But I get it. He wanted to encourage me, but just the way he did it was the wrong way.
Okay. Doc.
Yeah.
How do you deliver such news? And I know you might have dealt with quite a number of people that have gone through the same.
That's true.
So to a doctor, it seems like it's normal because it's your everyday life. You go through this, you test people, they turn out positive, and now you have to deliver the news, maybe 2, 3, 4, 5 people. So to you, it's different. To the person that is actually receiving this is the first time I'm hearing about this. How do you deliver that news in a way that is very compassionate to this particular patient?
I think, just to answer you, when you said we do it every day, but you see everyone who is diagnosed is different. Okay, so when you're delivering the news, that's how you need to understand. This is a person, they're not the diagnosis. Okay, so when, let's say, a young lady comes and she has the diagnosis of cancer, okay, you need to understand that, first of all, this diagnosis is going to hit her very heavily. Okay, so for you to give it with compassion, you need to first take her in a room that is isolated. There are no people there. Sit her down, okay? Ask her what does she understand about this disease, okay? Once she's able to tell you, then you give her the diagnosis, okay? It prepares the person, or it prepares the patient for the news that is coming. Okay, treating a patient like a diagnosis and not as a person. That's where people go wrong. They need to understand that this is an individual. They have a life they're living. They have people. They have family. And when you're giving them this diagnosis, it's not just an everyday diagnosis. Okay, so that's how you deliver the news.
Okay.
Yeah.
Help me understand, in the process of delivering the news, I've heard of stories where somebody says, oh, the doctor told me you have 6 months or 7 months. What is that language? What normally does it mean?
So when we are talking about that, what we talk about is the prognosis. Prognosis is where we're looking at survival, okay, with the disease, how long you have to live. But no one can exactly tell you how many days or how many months you're going to live. No one has that power. Okay? All we can do is just tell you, based on the studies we have, we've seen that this number of people, we have an 85% survival of 5 years. Okay? So for you, you're different. And you're an individual. It can take 5 years, it can take 1 year.
Yeah, and the reason as to why I'm asking that is because at times you'll hear somebody say, the doctor told me I had 6 months, and now I'm clocking a year.
Yeah.
And now I am a warrior, I'm a survivor, and all that.
Yeah.
So to some extent, you're like, okay, so what was this 6 months? Is it divinity in place? Was it misdiagnosis? What exactly happened?
And that's why I keep saying, no one can tell you how long you're going to live with whatever diagnosis you have, okay? All they can, with 100% surety, no one can tell you that, okay? Because as we know, and as you have seen, people respond differently to diseases, to drugs, and such and healthcare treatment. So if someone tells you you have 6 months to live, that person is not really telling you the truth. Okay. Yeah.
All right.
So, yeah.
Interesting. Something else I want us to look at is this conversation around cancer most of the time. To some extent, when somebody delivers the news or they find out that they actually they have it, it becomes like a death sentence to some extent. People look at it like a death sentence.
That's true.
Are we wrong to think that as a society that it could be a death sentence, considering the fact that we are celebrating survivors this month?
Yes.
We have a survivor here. There are more survivors out there. Is it wrong for people to look at it and say, are we wrong to look at it and say, okay, I've been diagnosed with cancer and this is it, this is it for me?
Yeah, I think when people think about cancer as a death sentence, they usually look at the years before, like 50 years ago, where we didn't have advancements that we have right now, especially in our country, especially here in Nairobi. We currently, you can get diagnosed with cancer, you can go through treatment, and you're going to go into remission and live for 15 years, 20 years. So a cancer diagnosis is not a death sentence. That's what people need to understand.
Okay.
Yeah.
A cancer diagnosis is not a death sentence. Yes. Yes, Nasra.
If I can add something on that, I think what comes in your mind first when you're given that diagnosis is the cost implication. Like for my case, I just thought of the cost implication, and then now how I'm going to be a burden to my family, who I know maybe they might not even be able to afford the treatment. So that fear alone, and then again the pain, because I used to Google the first days before now my mind shifted and everything to now positivity. I used to Google who had this, who died, who survived, what did they do. So, and most of the time I was going for the who died. And my husband could be so angry with me, like, why are you looking, which faith do you have? Why are you looking for just people who have died? Why can't you look for people who survived and see what they did and learn from them? Or rather, that's how my sister got to know about HCG Cancer Center. And I went there for therapy. And now I got a different, interacting with those patients and people who have been in this for a longer period. Now I saw things from a different perspective. But before that, the point is, people have died. Someone has been like They went to India, they spent all the money, they did what they could do, but they still died. So who am I? How am I sure that I will survive this?
Doc,
Yeah.
why does our mind always shift to the pessimism of it? And for example, she's talking about the first thing that she wanted to Google was who died from this, instead of who survived from this.
Yeah.
Why is that the first thing that clocks into our mind? That and that's why sometimes somebody looks at it and say it is a death sentence. This is the end.
Yeah,
for me.
and I think the reason people will, it's just the publicity that cancer has. And as I said before, if you look at the years in the previous century where people getting diagnosed with cancer, and we know definitely your time is short-lived. But currently, people need to understand that you're getting cancer is not a death sentence. When you get that diagnosis, you can actually get treatment here in Kenya. You can go, and there are so many places. We have, like she mentioned, Faraja, where people who have cancer get to meet and have therapy and discuss and, you know, have group meetings. You get to understand now that this is not a death sentence. You can actually have cancer, live, be in remission, and just live a normal life.
Okay, live a normal life. But one thing she mentioned was the cost implication of it, that you know, the mind just washes and it becomes a little bit chaotic. The cost implication, how expensive is it from your perspective when it comes to dealing with this disease?
To be honest, the cancer treatment is very expensive. For the normal Kenyan, they might struggle trying to get treatment, both in public or private hospitals. So when you're looking at a diagnosis, before you even start treatment, the process of the diagnosis to the treatment, you spend so much money. You need to get a biopsy, which is a lot of money. You need to do the scans. You know, you have a PET CT scan, you have the CT scan. Other times, we need to do what we call immunohistochemistry. You need to do gene testing. These are all very expensive. Now, when you're talking about the treatment itself, chemotherapy is very expensive, radiotherapy is very expensive. But there's some good news in terms of where we are right now compared to where we were.
So we've made some strides,
some strides.
Positive ones.
One of the strides that has been made is SHA, which has a dedicated package for cancer treatment. It helps a lot of patients who come to hospital. They can at least get treatment. They can at least get the scans done with little out-of-pocket payments.
Which one is prevalence when it comes to, you know, maybe here in the country and even across the region, the one that is very common to some extent, and how, quote unquote, dangerous is it?
So when you're looking at the most prevalent cancers in our country, we normally look at the first, breast cancer in women is the most prevalent. We have prostate cancer in men. We have cervical cancer in women. Then we have...
are you listing them in terms of the most?
Yes. Good. The most two. Because these are the top 5, and this is what we see every day. So breast has the highest numbers. Prostate in men, cervical cancer in women. We're looking at esophageal cancer, and then colon and rectal cancers. These are the most prevalent cancers in the country. In terms of, you've asked which one is more fatal? Well, we can't really say which one is more fatal, but we all understand that once you get these cancers, which are very common in our country, you need proper treatment. And if you get proper treatment, you can get survivorship. So talking about the lethality of one compared to the other, it would be a bit hard to... The
reason I asked that is because on the prostate cancer debate, I've had people send the message and be
Yeah.
like, no, it's not that serious.
Yeah.
You'll get better. Some
Yeah.
people have been there and all that.
Yeah, yeah.
So to some extent, reducing it to something tinier
Yeah.
compared to, I don't know what it should be or
Yes,
something like
yes,
that.
yes.
So based on what other people have actually gone through
Yeah.
before and actually, survived and became
Yeah.
warriors
Yeah.
as a result of the same.
Yeah.
Moving forward, as HCG,
Yes.
talk me through the process of someone has been diagnosed until the treatment itself.
Yeah.
What exactly happens when it comes to taking care of such a patient?
Well, when you're talking about a person who's newly diagnosed with cancer, first of all, when you come to the hospital, you need to first see an oncologist, someone who is trained to treat and deal with cancer patients.
Mm-hmm.
Okay, so this is the first point where now, with the diagnosis you have, you will do, let's say, scans or what we call staging scans.
Mm-hmm.
You can either do a PET CT scan, or you can do a CT scan of the abdomen, chest,
Mm-hmm.
okay, or an MRI. Using this information, this will tell us now how cancer is treated,
Mm-hmm.
okay? Because depending on the size of the tumor or if it has spread to other organs, it depends on, that's how we're going to treat that,
Mm-hmm.
that cancer, okay?
Mm-hmm.
So once you meet the oncologist, they do the staging scans, now you're ready to start treatment, okay?
Mm-hmm. Okay.
And if you have SHA or insurance, which will be very helpful, you get to do now the blood tests, which are required to see if you're fit for treatment.
Mm-hmm.
And now you discuss with the oncologist, who will give you like the types of treatment which you can take,
Mm-hmm.
giving you all the options. And currently in Kenya, as people used to think going abroad is better,
Mm-hmm.
currently in Kenya at HCG,
Mm-hmm.
we have all the treatment that you require
Mhm.
in terms of cancer
Mm-hmm.
in our country.
Okay.
New developed treatment, yeah.
New developed treatment.
Yeah.
But that treatment initially we said it's quite expensive. What makes it expensive?
Well, as you understand that this treatment, first of all, when you're talking about chemotherapy, these are drugs that are very advanced, okay? Some of them can't be made locally.
Okay.
They have to be imported, okay? Second thing, we're looking at the machines and the technology. Just an investment of a PET CT scan
Mhm.
requires a lot of money,
Mm-hmm.
or a radiotherapy machine
Mhm.
requires a lot of money. All these things add up to making that treatment very expensive.
Okay.
Yeah.
All right. Nasra, the message that we have for each and every other person out here, from your perspective, you've survived it. What will that message be?
Okay, the first message is, first, when you get your diagnosis,
Mm.
for me, I am talking about my story
Mm-hmm.
because I want, when someone is going online,
Mm-hmm.
they will not first meet who died,
Mm-hmm.
but they will meet who survived.
Who survived?
Yeah, because if you meet who survived, it quickly shifts your mindset
Mm-hmm.
to, oh, kumbe it is something people have gone through and
Mhm.
they have survived. But if you meet who died, then you start killing yourself,
Mm-hmm.
knowing that if she died, I will die.
I will die too.
Yeah. So if there are so many survivors, I know there are so many survivors out there, let us not stay silent, because by that we will be allowing cancer to win.
Okay.
But when we talk about our journeys,
Mm-hmm.
what we did,
Yeah.
how God came through for us,
Mm-hmm.
then it becomes a pillar to someone who is also struggling somewhere.
Okay. Let me ask you this. You've survived this. You are our warrior today. When you were diagnosed, so there's that particular process of you trying to come to terms with that particular reality, and how do you deal with it later? There's some myths that I'm sure you came across, and now that it is past that, you look back and you're like, okay, so it's not exactly what people used to say it was. That was a myth. This is the truth. This is the truth. This is a myth. Some of the myth that you came across, which one would you say?
First myth is that ni urogi, like witchcraft.
Mm-hmm.
So the first thing when you need, it's like you need to go to which ancient doctors, you need to look for this herbal medicine, you need to do this and that. But I thank God, just as I was giving you the story of my pastor, when he asked me to go and soul search and find faith, he referred to that story of the faith of a mustard seed. He told me, I want to see that faith as little as a mustard seed in you, and then you come for prayers. So when I went back the third time, I told him, now I have come, I want prayers. And he told me, now I can see the faith I was looking for. And then he held my hands and we prayed. And from there, my mind totally shifted and I looked at things differently. I was like, God is for me. I used to refer to Isaiah 43, verse 1 to 3, which says, God called you by your name, and even though you pass through the waters will not swipe you. And when you get through the fires, it will not burn or scorch you. So that is the verse that carried me through. And when I changed to that, I could wake up and pray and tell God, I know you're in this story. And I know as I'm leaving to go to hospital, as I'm leaving to go do this, you are with me. Because my family was so far, my husband was taking care of the household. I had no one to take me to hospital. I would walk to HCG reception and they're asking me, where is the patient? And I give them my ID and tell them, I am the patient. And most of the time, the receptionist could not believe, because I wore a very positive face throughout the treatment journey. And that is what made a friend of mine approach me and tell me, I've really admired how you've gone through this, and I would love you to share your story. And that is how I started the journey of sharing my story out here. Because he told me, I want you to do a video for us. Put it out there, because people know that cervical cancer is only for the old. And then again, that cancer is a death sentence. But according to how you have faced this thing gracefully, you can spread hope to people. And that is how I started it. And that is what I intend to keep doing, because I know people kill themselves with the fear before the disease even kills you. Yeah.
Interesting. And thank you so much for being the positive light that everyone actually is looking out for in this particular society as far as cancer is concerned. Doc, one of the things that, as we wind up on this conversation, is the issue to do with this causes cancer. It's a lifestyle. You need to stop doing this. If you don't stop doing this, this is exactly what is going to happen. Which is the truth and which is a lie? Some people will say, don't use the microwave because, this is going to happen. Don't eat this. It's likely to cause cancer. Is there some truth in some of the things that we actually get to hear?
Well, there's some truth, and then there's some false truth. When we're looking at cancer, there's so many things that might lead someone to getting cancer. We're looking at genetics. Maybe you can see that in a family, there are people who have cancer. Okay, so you are at risk of getting cancer. Two, when you're looking at lifestyle, we have seen cigarette smoking predisposes you to a lot of cancer. Alcohol taking, eating meats that is preserved, those salamis and sausages, they all might lead you to getting cancer. So there's a bit of lifestyle that we need to avoid. And then there's also an environmental exposure. People who work in industries and the chemicals might exposed to the chemicals and they might get cancer. So these are things that people need to know about. That's why when we have such talks, people get to understand now how people get cancer and why. Yeah. Okay.
In terms of screening, what would you say we shouldn't get to skip? Because sometimes they say make sure you go to get screened.
Yes, that's true. Screening is very important, especially when when you are going for screening. Screening means you go to the hospital when you're feeling well. You don't have any issues. You go get to be scanned and to be tested and to be examined, so that to see how you're doing. And I think most Kenyans are afraid of that.
Yeah.
They think some people will tell you, if I go there and then now I get diagnosed with this cancer,
Yeah.
that's when I'm going to get sick.
Exactly. I know somebody would totally think that.
Yes.
Boaz, to be specific.
Yes, but screening helps a lot because about 80% of the time, people have cancer,
Yeah.
but they don't express any symptoms. So the symptoms come when the cancer has advanced. Okay, so we have a chance to get the cancer early. We can treat it, and you can go into remission.
All right.
Yeah.
Okay. Final remarks. You are a survivor. You are our warrior. This is the month. Talk to us. Tell us. Tell us. Tell us.
Okay.
Yep.
Surviving is not easy because every day you wake up asking yourself, let's say you have a headache, let's say you have a backache. It's just something mere or something common, but you're like, could it be? Might it have come back? Might I be going back to the same thing I was? But now being able to do away with that thought and just say, no, it's just common flu or it's just common whatever situation it is, it takes a lot. It takes a lot of, you have to work yourself and work your mind so much to know that not everything you feel could be the disease coming back.
All right.
Yeah, so you and then again you have to take care of yourself extra because when I was going through treatment, I had to do a total overhaul of my diet. The things I could eat, the things I could not eat, the habit of taking water. I'm not a much drinker of water, but if I can surprise you, I used to take more than 3 liters of water a day. So just having to have
So it is
to
important to take
understand
water?
yourself. Yeah, very important.
All right. Thanks.
Very important because when you get to understand now such things and then also understand your body because our bodies react differently to the medicine, to the disease itself, and also to after the medication.
Okay.
So the things that you'll if you sit down and understand, and also the doctors play a big role in making you understand that yes, you are done with your treatment, but this is what you should expect.
Okay.
They should prepare you because there's a certain type of fatigue that comes in because of the radiation rays and all that. There's a like for me, because I did a total hysterectomy, so you get that I was sent into early menopause. So I experienced hot flashes. I experienced so many things that the older women go through. But them, at least maybe they were prepared. They knew I am going to experience this. But for me, it just came.
It just came.
So you see, I have to really adjust for me to be able to deal with someone might meet me in the morning and I am sweating and they're like, where kwani umetoka kulima? And I'm like, my friend.
So sometimes we pass judgments. We don't even know what is happening
Yeah.
with someone.
That's true.
And someone does not know. It is not my liking.
Okay.
It is something that I am going through and I'm also just trying to adjust living with it.
All right.
Yeah.
Thank you so much for sharing your story and being the face and the warrior that we actually need today as we mark this month. Doc, final remarks in 30 seconds. Something she mentioned here as you know, just 30 seconds, please.
Yeah.
In regards to what if it has come back?
Yeah.
The fear that somebody always has.
Yes,
So,
yes.
you know, you're going through something small and you're
Yes.
like, okay,
Yes.
could it be back? I'm a survivor, I'm a warrior.
Yeah.
But what if?
Yes.
Yeah.
I think such a fear is in almost all the patients who are treated with cancer. You need to understand that what you need to do is just go talk to your doctor, tell them this is how I'm feeling,
Okay.
and the doctor will guide you on how to handle such.
All right.
Okay.
Thank you so much. Nasra, of course, a cervical cancer warrior, and of course, Dr. Joseph Mageto, who is a resident doctor at HCG Cancer Center. Much appreciated for your time and making time for this conversation here as we mark the Cancer Survivor Month, that is June. All right? Yeah. We do this again in the coming days, right? Thank you so much. All right, my name is Brian Amuai. That does it for us here on K24 this week and this particular conversation here on K24. Let's do this again when God says we do. Do have yourselves a lovely time. Thank you.